Welcome to Mom Matters. I'm your host, Alyssa Dver. In the next 10 easy-to-watch minutes, we're going to give you practical tips for more productive parenting. Today we're at Brigham and Women's Hospital in Boston, Massachusetts, and speaking of parenting, we're talking about let's get pregnant and fertility options today that are available. We have a true expert with us, Dr. Rachel Ashby. I understand that your patients call you Rachel, which I think is fantastic. And you're a physician here at the Center for Reproductive Medicine at Brigham and Women.
That's correct, and I'm a specialist in reproductive medicine and infertility, and our group specializes generally in GYN complex issues as well as infertility.
And you typically work with OB/GYNs both here at the hospital and outside,
We do.
Right?
So typically if women are having difficulty conceiving, they will go to their general OB/GYN, who then refers to a reproductive endocrinologist and infertility specialist like me.
Okay, so when should something like that happen? In other words, how long should couples
Sure.
try before they engage this next step?
So generally, couples should try for approximately 1 year before the age of 35. After the age of 35, generally an evaluation is recommended after 6 months.
And what typically is the first step or first option in that respect?
So generally, the first step would be an evaluation of various aspects that can cause infertility, such as blocked tubes, low sperm count, and sometimes hormonal issues.
Okay, so you run those kinds of tests.
We do.
You see if there's a kind of physical issue, and then at that point, what do couples typically
So
do?
generally we meet for a counseling session, and oftentimes the testing will point us in a direction for a treatment option, but occasionally not, and sometimes it's unexplained infertility, and we go over the treatment options related to that as well.
So, I mean, you hear about this all the time in the news. Like, what is the real success rate in terms of couples that really get to that point where they need treatment options that are beyond a physical thing that they can work around? I mean,
Sure.
what are the success rates, quite frankly?
Well, interestingly, success rates are really stratified to age and diagnosis, so as you can imagine, it's fairly complex depending on how old you are and what the issue is. But I think an important thing to know is that success rates have been higher than they've ever been, and that many options exist that are quite successful for patients, regardless really of their age and of various medical issues that they may have.
Can you give us some examples of
Sure.
these options that you keep saying?
Sure. So some of the most common treatment options start with medications like Clomid therapy that occur with timed intercourse or intrauterine inseminations, and then sometimes injectable therapy with a hormone called FSH, or follicle stimulating hormone, with intrauterine inseminations exist, all the way up to our most aggressive therapy, which is in vitro fertilization. And those success rates typically are the highest.
And again, you've said that it depends on age, so the older
Right.
you go, I would assume that the less success.
But I would say it would be fair to say that the success rates really vary from the low of 15% per cycle to as high as 60 to 70% per cycle, depending on the age and the type of therapy
Wow.
instituted.
Wow, and you, of course, hear in the news women having babies later and later and later
Right.
with some of these treatments. So is there a prime time or a time that
Sure.
you suggest that's a good?
You know, age is really everything in infertility, so trying to conceive at the earliest possible time that you're ready is always best. And unfortunately, after the age of 40, it becomes a much tougher proposition, and some women in later life conceive even through other types of options, such as donor egg IVF.
Interesting, okay. Well, I think this is a good place for us to take a break, because when we come back, I want to talk about how do you know which option's right for you based on your lifestyle and your preferences and all that good stuff. So we'll be right back.
Every parent knows at any crowded venue, just a split-second distraction is all it takes. And without identification, your child is lost. Finally, there's a solution. Wanderwear. T-shirts and child identification tags that give parents peace of mind.
Welcome back to Mom Matters. I'm here with Dr. Rachel Ashby talking about fertility options. And we've talked through some of the options out there. So how do you know what's right for you?
Well, it's really a complex decision based on whatever the results are of your initial workup, as well as whatever the particular situation is known to the physician regarding you and your partner. And those treatment options usually become fairly obvious after that workup.
Interesting. Is there ever a situation where a physician or someone in your position would say this one is particularly good for someone versus otherwise?
Absolutely, and what we try to do is discuss at length really the risks and benefits of each of these options, because they are complex in regards to the risks of multiple pregnancy, expense associated, and sometimes the timing involved. So those are all counseled extensively in a visit with a doctor like me.
Absolutely. Well, let's talk about multiple pregnancies, because again, that's another big media favorite. Chances of having multiple pregnancies with fertility options, is it regardless of the option, or is it particular options are more prone for it?
Well, it's really regardless of the option, but the good news is that we've made great strides in our field in trying to avoid multiple pregnancies. Sometimes the concern is that patients really embrace the idea of twins, but we as physicians know that it is a higher risk pregnancy, oftentimes fraught with issues such as early delivery. So a real emphasis on most groups is trying to promote healthy singleton pregnancies. So we've really gone a long way toward reducing those risks of multiples pretty much on each therapy, and probably in vitro fertilization is where we have the most amount of control, and we frequently do single embryo transfers to help aid that issue.
Oh, okay. So it has gotten
much better.
Better over time.
Absolutely.
Very good. I know one of our producers who has 1-year-old twins, and will be happy to hear
Yes.
that.
Yes.
What about insurance? When people
Sure.
come to you for these treatments, are they typically covered?
Right. Well, so we are so fortunate in the state of Massachusetts, and that is we have a state mandate that enforces all health plans based out of the state of Massachusetts to cover infertility care, which is wonderful. Unfortunately, that is not uniform, and only a few states in the United States really have that as a coverage benefit. So it's certainly something that you can check on websites that will allow you to know, and sometimes individual policies, depending on your company, do cover it as well.
Okay. And we talked a little bit about, you said the cost could be a factor. I mean, is there a range that these procedures or options?
Yes, absolutely. Some of the procedures and options, including Clomid therapy and intrauterine inseminations, can be quite affordable, with Clomid ranging from $30, $50 a month, and most inseminations ranging from $200 to $400 a month, on up to the most expensive therapy, which is in vitro fertilization, which probably a fair range would be between $8,000 and $12,000 a cycle.
So it's a lot of money. So it's important to check if your insurance covers it. You said websites. I know that there's some good resources for people who want to learn more about this very hot topic.
Absolutely, and one of my favorites is the National Support Group for Women Undergoing Infertility Treatment, which is Resolve. So you can Google on Resolve and find it easily. And they have both tremendous patient education bulletins that you can read, as well as kind of resources for emotional support, as this is such a difficult time for most patients.
Sure.
And then in your area, most infertility groups have websites that are both educational and informative in regards to how to get started with the process and the different aspects of the process and the physicians involved, so that you can help choose who it is that you would like to see. And then finally, the CDC website puts out SART data associated with the different success rates of the various groups. So being an educated medical consumer is also helpful to pick the group in your area that you feel you would most benefit from.
Excellent. Very good resources, and we'll be sure to post those as part of the summary on our blog and website, which I want to remind our viewers is mom-matters.com, where on our site you can see our previous shows as well as information about future upcoming ones. So I want to thank you, Dr. Rachel. Thanks for being here. It was very interesting, a great topic. And thank you to our viewers. This is Alyssa Dver from Mom Matters, giving you practical tips for more productive parenting.